Today we are covering HIPAA and patient confidentiality, a critical area frequently tested on the NCLEX. The exam will not ask you to simply define HIPAA. Instead, it will test your ability to apply its principles in realistic clinical scenarios. The core concept you must understand is protected health information, or PHI. This is any information that can be used to identify a patient, including their name, address, date of birth, diagnosis, or even their room number when combined with other data. The exam loves to present situations where a nurse unintentionally violates HIPAA. For instance, a question might describe a nurse discussing a patient's challenging diagnosis with a colleague in the hospital elevator. Even if they don't use the patient's name, but mention the room number and specific details, this is a HIPAA violation because it's not a private setting and the conversation could be overheard. The correct action in an exam question is always to protect confidentiality, meaning the conversation should have occurred in a private area like a nurse's station. Another common exam trap involves the minimum necessary standard. You might see a question where a nurse from another unit, who is a friend of the patient's family, asks for an update. While the motive may seem harmless, providing information violates the minimum necessary rule. This nurse has no professional need to know. The correct response is to politely decline, stating that you cannot share patient information, and perhaps direct them to the patient or a designated family spokesperson. The NCLEX will also test your knowledge of permitted disclosures. Information can be shared for treatment, payment, and healthcare operations. A classic example is a nurse providing a report to the oncoming nurse, which is essential for continuity of care. However, sharing that same information with a hospital chaplain who is not directly involved in the patient's spiritual care at that moment without patient consent would be a violation. Be wary of questions involving social media. A nurse posts a picture of a unique piece of equipment, but in the background, a patient's chart with a name visible is on a desk. This is a clear violation. Even posting vague details about a tough day with a patient can breach confidentiality if there's enough information for someone to potentially identify the individual. The exam expects you to recognize this as a serious professional boundary issue. Here's a simple phrase to remember when you're unsure. When in doubt, don't give it out. This mental shortcut is your safety net. If a question presents a scenario where someone is asking for information and you feel a slight hesitation, your instinct is probably correct. Whether it's a family member not on the consent form, a curious colleague, or a seemingly innocent inquiry, your primary duty is to protect the patient's privacy. Choose the answer option that reflects this principle. Finally, remember that patients have the right to access and obtain copies of their own health information. A question could involve a patient asking to see their chart. The correct nursing action is not to deny them, but to follow facility policy, which usually involves facilitating the request in a formal, documented manner. Denying access is incorrect and violates the patient's rights under HIPAA.